Okay. Do you have any specific favorites that you like, or any specific bioflavonoid combinations that you have found useful over the years?
Well, not in not none that I can specifically think of. I mean, I just tell people to eat a really good whole foods, colorful diet, and you're going to get a lot of bioflavonoids that way and carotenoids. The more colors, the better, and that's where you get the phytonutrient synergism that can be very effective in maintaining health and keeping the cell in a balanced state of redox.
Now, one of the other uses of vitamin C, and I want to talk about some of the conditions that you found helpful aside from infections and cancer, would be the indication of bruising or easy bruisability, capillary fragility. And typically, it's not just vitamin C; it's the associated bioflavonoids that are useful there. And one of the other conditions and side effects you can have if you have this tendency is you could actually be far more easily predisposed to hemorrhoids because that's
Yeah.
sort of a complication. So they go hand in hand. If you have easy bruising, you're likely going to have an external and internal hemorrhoid. So what have you found to be useful for this therapeutically?
Well, I just once again, I think we probably put every patient that we see on vitamin C, and I myself in medical school had trouble with hemorrhoids, and until I actually got on vitamin C, I would have bleeding hemorrhoids and bleeding gums. So the top and bottom were bleeding. So that tells you that I was vitamin C deficient all through medical school and through the early years of my practice. But in the last 20 years, my gums don't bleed and I don't have hemorrhoids, and I take a lot of vitamin C.
You
So
take
I really
you take the bioflavonoids too, or
uh, let's see there. I take I take grape seed extract regularly, and I usually take quercetin. Uh, but I don't take a bioflavonoid mix per se. Would probably be a good idea, but I don't
well,
take that.
I'm when I reviewed this for a friend who had this problem, I found that rutin seemed to be particularly
Yeah,
useful.
root would be. I agree. That would be excellent.
And rutin by itself, and not to diminish the importance of the need for vitamin C, but rutin by itself, I think can reverse the bruising and the tendency towards hemorrhoids. So it's just a little
Yeah.
hint that I learned. It seemed to work well for the person I recommended it to.
Now there's an interesting thing about dosing. Mark Levine published a study where he basically said that it does. There's no need to take any more than about 220 milligrams a day of vitamin C because it's just going to go out. But Dr. Steve Hickey, who has written a book called Ascorbate, has shown that if you take vitamin C frequently throughout the day, you can achieve much higher plasma levels. So even though the kidneys will tend to rapidly excrete the vitamin C, if you're dosing it every hour or two, you can maintain a much higher plasma level than if you just dose it once a day,
All right.
unless you have an extended release form of vitamin C.
Okay, so that's a good point, and kind of leads me to one of my next questions, which because we have many people who wrote in asking about this, which is ester C, and I'm sure you've got some views on that. So if you can share that with us, we'd
Yeah,
appreciate.
it's a buffered form of vitamin C, and generally, a lot of people who can't tolerate vitamin C, they really can't tolerate ascorbic acid. The ascorbic acid tends to disrupt their gut in such a way that they get gastrointestinal distress. Ester C is better tolerated because it is buffered, and it seems to be that the vitamin C derivatives that are used to make that stay in the bloodstream longer than just straight ascorbic acid.
Well, I had some concerns about ester C, and perhaps you can address them. And just for a basis of understanding for our listeners and viewers, is that vitamin C is an antioxidant because it's an electron donor, and it only is doing that if it's in the reduced state. If it's in the oxidized state, it doesn't really work well. And there's rejuvenators like coenzyme Q10 in the system that will reoxidize it or reduce it so that it can donate electrons again. But my understanding is that most of the ester C is oxidized and not as beneficial, but I'm wondering what your experience has been.
Well, there was a study at Sloan Kettering a couple years ago looking at the effects of dehydroascorbic acid on cancer cells, and it was a negative study. And basically, to me, it was a big duh. I mean, I would not use an oxidized form of vitamin C. Now, the idea that ester C is an oxidized form of vitamin C is new information to me. I did not know that.
Yeah, that was my.
So,
That's why I've always avoided it and discouraged people from using it. So, and that could be mistaken, but that's my current understanding. And
I would not recommend using oxidized form of vitamin C, much in the same way with CoQ10, the new ubiquinol, which is the reduced form, appears to be more effective at the cellular level than the oxidized form, unless you're a young person and have a really active uh, ability to regenerate your antioxidants.
so yeah, sometimes the devil's in the details. There's no question
Yeah, no question.
about that. So, do you find are there any ages or concerns with ages giving vitamin C? Like, would you give it to a newborn or an infant? Obviously, it would be not an oral version, something they would chew or swallow or drink.
No. Dr. Klenner, who was a pioneer in vitamin C, used to give his pregnant mothers 3 to 6 grams a day, and so my daughter, who just had our first grandchild about 14 months ago, I think she took 4 or 5 grams a day and had a very easy delivery, and she's continued to give her daughter, at least 250 to 500 milligrams per day. I would strongly encourage it. Most pediatricians accept the fact that babies will have 8 to 10 upper respiratory infections in the first year of life. Well, that's true if they are low in vitamin C, but if you give them adequate vitamin C and vitamin D and a couple of these other nutrients, the kids just don't get sick. And this has been true for our granddaughter. She's been in a daycare setting and she's been the only one I think she's had one upper respiratory infection in 14 months.
Yeah, I might add that there's probably a powerful synergy which is the new craze vitamin, which is vitamin D, and thankfully it's gotten more recognition. Really, it truly is not a vitamin, of course, because vitamin is really reserved for the terms that we can only get from our diet, and we can clearly get vitamin D from exposing our skin to sunshine, a proper amount of sunshine. So.
Right.
But vitamin D has many similar benefits, and when you combine that with therapeutic levels of D and vitamin C, you really make it very difficult to get sick.
Yeah,
which
I've had many patients in the last year say they've been through the winter months without getting ill, and it's been and knock on wood, it's been over 2 years since I've had a respiratory infection.
Yeah, and just as an aside, but I think an important comment, and certainly I'd like you to address this too, because you have a lot more experience in this, with your focus on cancer. But it's my personal belief that if you have a proper lifestyle, you avoid most of the toxins, are exercising properly, you have optimized vitamin D levels, optimized vitamin C levels, or taking regular amounts of it, and really pretty much eating a healthy diet, staying away from the bad stuff, that processed foods and other components, that it's very, very unlikely you're going to come down with cancer. That you essentially, by following this type of lifestyle, you immunize yourself against well over 90%, maybe over 95% of potential malignancies.
In the symposium that I just came from, we the one we had 2 weeks ago, we talked a lot about cancer being the non-healing wound, and this is a new concept and what cancer is. And most people think of cancer as something from the outside that has taking over the body, and kind of the invasion of the body snatcher type thing. But in reality, it appears that cancer is a maladaptive response to sustained injury. And if you take any area of the body and injure it with toxins, radiation, you name it, and the body attempts to heal that wound but runs out of healing resources, then that wound will start to turn cancerous. The non-healing wound will start to turn cancerous, and it turns out that cancer may itself be the healing process maladapting to a nutrient deficient situation.
Well, I love that perspective. So what level of immunity do you think it would provide if you had an optimized lifestyle? I mean, how much do you think it would reduce your risk of anything? I know it's just a guess, but your guess is better than mine because you see this all the time.
Well, Dr. Roger Williams, the great nutritionist researcher, basically said that the environment of the cell can always be improved, which means that any of us, all of us, could do a little bit better at any given time. But if you're really working from an optimal state where you've got all your nutrient levels optimized, you've got your toxic levels reduced as much as possible, you're getting exercise and sleep, and just coming from Japan, there's a term that I learned called Ikigai. Ikigai. Ikigai means your purpose for living. If you've got a strong Ikigai, I don't think you're going to be nearly as likely to get cancer as someone who's malnourished, leading a absurd existence, not getting enough sleep, exposing themselves to toxins. A lot of our toxins are self-exposed toxins. I think those people are going to be at a much higher risk for cancer compared to someone who's taking good care of themselves.
Well, that's what I was trying to get number-wise. Do you think it might be as much as a 90% reduction in the likelihood? Because it's all a matter of...
I would like to think so. I mean, I know my whole reason for being in this field is so I could learn how to take better care of myself and my family. And I'm not planning on getting cancer, but I do see patients who think they're doing everything right and they still get cancer. So that's why we do encourage nutrient testing and various ways to assess your state, because you do need reality checks, because sometimes people think they're doing good, but they're not doing as good as...
Well, and another common reality check that is really, there's virtually no way to know, you can't perceive this, is your vitamin D level. And we know that
you got to do blood levels on that.
There's just, you just don't know. And even though you think you're swallowing enough, even maybe 5,000 units, there are people that I've seen, I'm sure you've seen too, who need 20, 30,000 units a day. Or 2 hours of exposure to sunshine, or a combination of something. So you got to get up there. And if you're treating cancer, you probably want to get closer to 80 to 100 nanograms per milliliter to treat that effectively, rather than the 50. So it's a very powerful thing, and I'm glad you brought up that point.
And that's where, Dr. Reardon, my boss, who started our clinic, he basically said the big missing piece in nutritional medicine was the use of the lab to verify optimal levels. Yeah. If you now, not everyone's going to have the resources to do that, but if you can periodically get tested, that's going to give you, to me, that's probably one of your best ways. I look upon nutrient levels as kind of tumor markers. If you've got good nutrient, if you've got a very good vitamin D level, that's as good as having a low tumor marker.
Yeah, and let me just go off on another little tangent here, because I mentioned the vitamin D level, but during my lectures, there's a few other simple tests that can be done. That is to check for iron or ferritin. And ideally should be between 20 and 80, because I'm sure you've seen and experienced what I have, is as many as 20% of the people out there have elevated iron levels, which will increase your risk of cancer.
That's exactly right.
And you don't need to take a supplement for it. All you need to do is donate your blood. It's the most effective way, a therapeutic phlebotomy. And you can radically reduce and eliminate that risk factor. So a ferritin level. Insulin level, that tells you if your diet is appropriate, if you're exercising and you're eating the right amount of protein, carbs, and fats, and your insulin receptor sensitivity. It's another huge risk. So those are 3 simple tests.
Actually, Joe, the people that go in and see their cardiologist and get lipid levels and blood sugar levels, all the risk factors for heart disease are very similar to the risk factors for cancer. So if you've got an elevated glucose, elevated lipids, and an elevated CRP, we think the CRP is a pretty good tumor marker. And so those are things you need to work on, and work on your level of inflammation. There's a really nice new book out now called Anti-Cancer by Dr. David Sargon-Schreiber. And he has a beautiful chapter on how what you eat modulates your level of inflammation. And so just for people becoming aware of their CRP and learning how to eat better and take better care of themselves in order to lower the CRP, that can make a huge difference right there.